This is the news in brief from the United Nations. The last barely functioning hospital in northern Gaza is a humanitarian disaster zone, the UN World Health Organization WHO said on Tuesday, highlighting the disastrous consequences of ongoing Israeli bombardment for critically ill and injured civilians across the enclave. Briefing reporters from Gaza, Dr. Richard Pieperkorn, WHO's representative in the occupied Palestinian territory, described corridors overflowing with trauma patients at Al Ali Hospital in Gaza City, where fuel, oxygen, food and water are scarce.
I've never seen scenes like this in my life. The doctors are really forced to prioritize who receives care, who doesn't. They're treating many of the serious cases in the corridors or on the floor.
In just 66 days of fighting, the Strip has been transformed from a reasonably functioning health system, producing health indicators on par with neighboring countries, to a situation where more than two-thirds of its 36 hospitals and over 70% of primary healthcare facilities are out of commission, Dr. Pieperkorn said. Last Saturday, a WHO-led UN and Palestine Red Crescent Society (PRCS) convoy encountered serious incidents during a mission to deliver trauma and surgical supplies for 1,500 patients to the hospital and evacuate 19 critical patients and their companions to the south, the UN Health Agency said. The convoy was stopped twice at a checkpoint and medical staff were detained, causing delays. One of the injured patients reportedly died as a result of his untreated wounds. Staying with health, half of the world's population is not fully covered by essential health services, and 2 billion people are impoverished because they must cover medical bills out of pocket. WHO warned on Universal Health Coverage Day, observed on Tuesday, that without urgent action these gaps will only widen. Health Agency Chief Tedros Adhanom Ghebreyesus stressed that investing in resilient health systems based on strong primary health care is the most inclusive, equitable and cost-effective path towards universal health coverage, defined as a situation where all people can access the health services they need without financial hardship. Health systems that can respond to shocks, such as the fast-advancing climate emergency, can avert millions of additional deaths each year, WHO insisted. In a political declaration last September, world leaders committed to redouble their efforts to achieve universal health coverage by 2030. WHO said that it is working with countries to reorient health systems towards a primary healthcare approach that can help deliver 90% of essential health services while saving 60 million lives by 2030. Food insecurity has continued to worsen in West and Central Africa, with the number of hungry people set to reach a staggering 49.5 million by the middle of next year, UN Humanitarians said on Tuesday. Acute hunger remains at record levels in the region, yet funding needed to respond is not keeping apace, UN World Food Programme WFP Regional Director Margot van der Velden said, stressing that for lack of funds, WFP has been forced to scale back life-saving assistance for those in need. Acute hunger in West and Central Africa is mainly driven by conflict, which has driven millions out of their homes and farms, along with the climate crisis and high food and fuel prices. More than 2 in 3 households cannot afford healthy diets, the cost of which in countries like Burkina Faso, Mali and Niger is 110% higher than the daily minimum wage. 4 in 5 of the region's youngest children do not consume the minimum number of food groups they need for optimal growth and development, WFP warned, together with the UN Children's Fund UNICEF and the Food and Agriculture Organization FAO. In the first 10 months of 2023, 1.9 million children under 5 were admitted for treatment due to severe wasting across 9 Sahel countries, representing a 20% increase from last year. Dominika, Tomaszewska-Mortimer, UN News.